Families flock to parks and other outdoor leisure sites as children aged 5 and above are now allowed to go out of their homes. A research group notes that several areas in the country are now trending flat in terms of COVID-19 reproduction rate. Vice President Leni Robredo calls on the government to declare an education crisis and address worsening issues in the sector. State volcanologists record a sudden increase in the number of volcanic quakes in Taal, which remains under alert level 3. And China rolls out new innovations as it targets to dominate the world of artificial intelligence by 2030. Fast, focused, and fearless, here's a roundup of stories we're watching now. I'm Riza Diaz. After more than a year of being stuck at home, children are now allowed to go outdoors in GCQ and modified GCQ areas. Camille Samonte with the story.
Some families visited the Manila Baywalk on Sunday following a new policy that allows children aged 5 years and above to go outdoors in areas under looser restrictions. Marco Lorenzo immediately took the opportunity to let his 2 kids play.
Malaking tulong kasi unang-una sa resistensya ng katawan. Kasi pag sa bahay, limited yung mga activities eh. Hindi naman po ganun kalakihan yung bahay namin. Hindi naman sila makakatakbo. Mas maganda talaga nasa labas, nakakatakbo-takbo sila. Tsaka yung social interaction nila sa ibang bata.
However, Marco's youngest child is only 3 years old and is not covered under the new IATF policy.
Bawal siya pero kawawa naman, di ba, kung maiiwan yung isa. Sinama na po namin, mayroon naman po siyang face mask. Ingat na lang din po. May dala kaming mga alcohol, ganyan.
Lizelle Duran also brought her 1-year-old nephew along her teenage grandchildren.
Sa tagal po ng panahon na hindi nakakalabas yung mga bata, at least ngayon pinayagan na po. Kaya masaya para sa mga bata. Siyempre sila malungkot kasi sila pag tsaka yung kulang sila sa exercise. Kasi nga hindi nakakalabas ng bata.
Although excited with the new policy, Ruel Jonel said they are still taking necessary precautions.
Natakot siyempre kasi pag galing kami sa labas, uwi ng bahay, siyempre kailangan namin na mag-ingat din para sa mga anak namin, para di sila mahawa.
Malacanang announced on Friday that the new policy will only be implemented in areas under modified GCQ and GCQ, except in areas with heightened restrictions. Those aged 5 and above are allowed in outdoor areas such as parks, beach, playgrounds, and outdoor tourist sites, among others. They are also allowed to engage in outdoor non-contact sports and dine in alfresco establishments. But malls are still off limits to children younger than 15 years old. Health Undersecretary Rosario Vergeire on Saturday stressed that despite the easing of restrictions for children, adult supervision is still required.
We must ensure that the caregiver or the parents are there to supervise and that they will be wearing their mask at saka hindi po sila talaga magva-violate ng safety protocols natin.
Vergeire also noted that the IATF allowed the new policy for the mental well-being of children.
Meron na ho mga pag-aaral na talagang na ho ang ating mga kabataan dahil po dito sa pandemya at sa lockdowns. It is already affecting their physical and mental health, and this is based on evidence already.
The government also authorized LGUs to modify the age restriction depending on their COVID-19 situation. The Metro Manila Council held a meeting earlier today to discuss how the policy will be implemented. They have yet to release uniform guidelines. For News 5, Camille Samonte, We Are One News.
To give us more details on local guidelines concerning this new policy, joining us this evening via Zoom is Marikina Mayor Marcy Chodoro. Mayor Chodoro, good evening.
Yeah, good evening, Risa, and good evening to everybody.
Mayor, we know Marikina is known for its parks, beautiful parks.
Yeah,
In general, how did your constituents react to this new policy?
this is welcome news to everybody, considering that more than a year we've been under lockdown, and on the first opportunity, our children can now go out. But of course, we would like to ensure that they will be safe outdoor, following or observing the minimum public health standard necessary in order to ensure public health and safety for everybody.
Mayor Marcy, has the Metro Manila Council agreed yet on unified rules regarding the easing of restrictions for children? And if so, what issues, Mayor, were raised during your discussion with other local executives?
Earlier this day, we had a meeting, and I think everybody is in agreement that we should have a uniform standard or protocol to follow in order to avoid confusion in compliance to the minimum public health standard. Considering the fact that our borders are porous and people are highly mobile, for example, residents coming from Marikina can go to Makati, for example, or to Manila to visit an area in the said jurisdiction. So there's really a need to adopt a uniform standard. What we are trying to define is that how to effectively implement social distancing among people visiting, for example, a park or a playground. We should be able to determine the carrying capacity of the said area and effectively implement the said capacity.
Mayor Marcy, let's just go back. Were local executives consulted before the new policy was even announced? And were there reservations among your colleagues, among Metro Manila mayors?
We were informed that there will be announcement by the IATF. However, in terms of the details on how it will be implemented, I think the resolution is very clear on this matter, that the LGU will have an autonomy in terms of increasing, example, the age restriction. Secondly, to implement supplementary rules or supplemental guidelines in order to maintain the gains that we have achieved in our fight against COVID. Binigyan nila ng leeway ang mga local government units. Pero sabi nga namin for practicable reasons and to avoid confusion in compliance, in terms of compliance, we decided that the Metro Manila Mayor should adopt a uniform protocol and standards in promulgating the IATF resolutions.
Sir, nabanggit niyo po kanina, one of the, of course, concerns is to maintain social distancing in parks, in public places like this.
Yeah.
What are other safeguards, Mayor, that will be in place, let's say in Marikina, to ensure that the children are properly supervised and that those who actually go outdoors are age 5 and up?
In our meeting earlier among the Metro Manila mayors, we will be identifying the parks where children will be allowed to go to or to visit, so that we'll have an area where we could strictly implement the regulations that we have. Similarly, we're thinking of deploying protocol officers, safety and health protocol officers in the said areas in order to strictly implement the minimum public health standards necessary for the safety of our children. What primarily it is anchored on two conditions, as earlier discussed. First is that the child should be supervised on adult, should be supervised on adult or adults. Secondly, there should be always observance of the minimum public health standard. Yung ibang mayor, pinupush nila that the adult that should be able to supervise should be vaccinated. Pero yung ibang mayor, ang pinag-uusapan, sinasabi naman, how can we require adult supervision to require them to be vaccinated if we cannot fully vaccinate everybody at this point in time because of the supply problem that we're having.
Well, thank you, sir, as always, for your time and sharing us your insights. That's Marikina Mayor Marcelino Chodoro. Now, over in Quezon City, the LGU has designated 19 open-air locations suitable for children. Mayor Joy Belmonte identified several city-owned parks and other sites inside residential subdivisions as child-friendly safe zones. Minors 5 years old and above may enter the areas for non-contact activities, provided that they are accompanied by a fully vaccinated adult guardian. The Health Department records nearly 6,000 new COVID-19 infections. This brings the country's total caseload to 1.47 million, nearly 50,000 of which are considered active cases or patients who are still undergoing treatment. The DOH also logged more than 100 patients who did not survive the infection. The death toll is now inching closer to 26,000. Meanwhile, more than 6,000 patients recovered from the disease over the past 24 hours. This brings total recoveries to 1.39 million. NCR sees a slight increase in COVID-19 reproduction rate from 0.85 last week to 0.91 this week. Despite this, the Octa Research notes a flat trend in the capital and other areas. Octa Research fellow Guido David explained on One News Now that a flat trend entails no improvement. David reiterated that the country has not achieved a victory yet in the fight against the virus.
Flat trend does not mean, well, this is different from saying the curve has flattened. A flat trend means that the cases are basically remaining the same. And then, in fact, we're seeing this right now. More or less, we're just seeing about 6,000 cases per day right now. It's neither increasing nor decreasing. I mean, there may be a slight increase or decrease here and there, but the overall trend seems to be that it's neither going up nor going down.
David also noted that there are still areas that have high ICU utilization rates, such as Davao City. He said the timeline for a steady downward trend will primarily depend on the pacing of our vaccination program.
In the NCR, we should have about 20% fully vaccinated by sometime in August, maybe third week of August, and maybe 40% by mid-October. If we reach those targets, that would be great because we could further ease health restrictions and open up more businesses.
Vice President Leni Robredo is calling on the government to declare a crisis in education to address the needs of students and teachers hit by the COVID-19 pandemic. Robredo's call came after the World Bank reported that the Philippines has poor state of education based on various international metrics. She also cited an assessment from the Asian Foundation that said 34,500 of the schools have no internet access, while 5,000 are without electricity. The World Bank subsequently apologized to the government and DepEd for its quote inadvertent release of their report. But for Robredo, the DepEd should focus on fixing education problems instead of asking for an apology from international bodies. PHIVOC says the increase in volcanic quakes in Taal indicates that the volcano is still very much active. Speaking on One News earlier today, PHIVOC's officer in charge, Renato Solidum, said that the Taal volcano saw a surge in volcanic tremors in the past 24 hours. Yesterday, PHIVOC only recorded 8 volcanic quakes as compared to the 74 recorded overnight. Solidum also noted that Taal's sulfur dioxide emission is still high, meaning that a magma is still moving and degassing. When it comes to dominating the industry of artificial intelligence or AI, China is looking only at the 9-year time frame from now on. So if you come to China in 2030, expect a robot to serve you at a coffee shop or even give you a massage. Let's watch this report from Bloomberg.
首先，它这个运动的轨迹啊，一定是大师级别的这个手法的这个数字记录。对，跟一般的这种按摩师相比的话，它的手法要更准确、更精确。那第二个就是说，我们搭配了这个3D 成像，可以根据人不同的体型，然后找到每个人的穴位，可以针对性的按摩。
家庭里面我们已经能够实现的功能呢，是包括是说我们能够给你到冰箱里面拿可乐，开可乐、开饮料，然后呢给你那个拿报纸、拿雨伞，然后呢浇花，帮你下象棋，让你这个唱歌、这个做作业，然后语音聊天等等的这种情感互动，包括语音互动的部分。那我们未来其实对于整个家庭走入千家万户，其实会实现一个多元化的这个角色。我可会扮演你们家的这个保姆，会陪伴你成长，小朋友、老年人，会也是一个家庭的教师，也是一个家庭的这个真的是一个这个多元化的这个做不同家务的保姆。
这种高效的这种检测啊，对于精准的诊断啊，以及去实现这个可以说及时的治疗是至关重要的。这个只靠这个人工是没办法实现的啊，因为以中国为例，中国是有广大的这个就是可以说偏远的地区。那么偏远的一个小乡村，它是不可能去这个大医院去做快速的这种骨髓的形态学检测的。那么如果没有我们这样的这个系统啊，那么可以说这种偏远地区的这些血液病患者的他的生命健康是没有得到没有办法得到有效的保障啊，这不是中国的一国的问题，是全球性的问题。
And for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now, www.signalplay.com, and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.